Hi, I'm Denise and I'm a counsellor and I wanted to make a video today because I have lots of clients' comments and lots of inquiries about counselling that involves quite a lot of myths and stereotypes. So I thought it would be great to make a video just to talk to you through some of the major ones and kind of debunk some of those myths and tell you a little bit about what to expect. I am going to do another video on what counselling is and how it works. But for this video, I've made a list, so I'm going to read through some of the major myths and sort of debunk them. So you'll have to excuse me if I glance down now and again. But the first one I want to start with is quite obvious. So many people will have seen a TV show, a drama series, a film, or read in a book about counselling. And normally it will be depicted with that person lying on a couch or a sofa and the counsellor sitting behind a desk and taking notes. This is not what counselling is. There's a brand of counselling called psychodynamic. It's a particular model that a lot of people will have a more traditional approach with. But even in this country now, it's not something that's used very often. I'm a person-centred counsellor, which means that I put my client at the centre of the work we do. And so often when people come into my counselling room or they work with me online, they're quite surprised that, there's nowhere to lie down. But counselling is a two-way process, so it's like a dialogue, like a conversation. So in my room, there's pictures on the website, which I'll put in the comments below. There's two chairs that I face, and I'm in a chair, and there's a small coffee table between us. And it is small, so it's not a barrier with some tissues and things on. So it's not kind of the Freudian type of counselling that you might have seen depicted, but it is one of the most common misconceptions that we see. Another one that I get quite often is, oh well, counsellors will just nod and agree, they don't speak. I can assure you that's not the case, and many of my clients will know that it really is a two-way process. If a client's coming to you to talk to you about their experiences and their concerns, then obviously if they got no feedback at all and they were just sat in silence, then it would feel quite difficult to hold that. Now there are some silences in therapy and they're used as a time to reflect or pause and can often aid the therapeutic work, but the whole session isn't done in silence, and the counsellor certainly doesn't just nod and go, that's not what happens. Also, I think sometimes people come to therapy expecting the counsellor almost to give them a to-do list, like this is how you're going to fix your problems and solve them. And that's not what therapy is about. Therapy isn't a space where you're told what to do. Therapy is a space where you work through your concerns, you talk through the things that have happened to you or that you brought you here. Now the counsellor might use coping strategies and get more practical things to work with, but certainly it's not a to-do list with a you should do this and you should do that. So it's not advice or guidance, it's a very different type of relationship. One of the things that, again, I think clients often think is that if you see a counsellor, then for them to understand your concern, they must have gone through the very same thing. Now, it's no secret that most counsellors and therapists are what we call wounded healers, so they've had life experiences that has drawn them to the profession. However, it's not necessary for the therapist to have experienced exactly the same life as you to empathise and understand. It's really important to see that you are the expert in the room. So although the counsellor, i.e. me, is trained in a variety of skills and techniques to support and help you, no one knows you like you know yourself. So there'd be no way a therapist could tell you what you're thinking and feeling. Which leads me nicely on to two different things. One of them is that a therapist will make you talk about things you don't want to. So that a counsellor will sit you down and say, right, you have to tell me about that most painful, awful thing that happened to you. Again, you're in control in the therapy room. So it might be that a counsellor will suggest that you look at something that's difficult, but that doesn't mean giving a blow-by-blow account of what's happened. And if you're not ready to express or look at that, then again, it's important to pace the therapy correctly. And then the other thing is as well is that a counsellor will always bring it back to your childhood or your parents. So often when people come to therapy, they'll have one particular concern. They might say, I'm anxious, or I had a car accident, or I've got stress at work, or it could be trauma. And what people don't realise is often it's not that one thing that's impacting on them. There's a variety of things, or the things that are coming to the forefront are about their past. So what often happens is people might come to therapy about anxiety, and then in a session they might start talking about their childhood or their parents. And it's not a critical way, it's not a blaming space, but it's to say that each of our interactions and the things we experience in life will have an impact on us. So it's quite normal, I guess, that people will bring that up in counselling. Often there's a misconception that you're going to come for 1 or 2 counselling sessions and you're going to be fixed and life is going to be brilliant and every day is going to be the best. Counselling is not an easy path or a quick fix. There is no magic number of sessions that is right for each individual. A lot of it depends on what you're looking at, what you're feeling, what you're thinking, if you've had therapy before, if you're aware of what's going on for you. So 1 or 2 sessions really is just the beginning of the introduction for the therapeutic relationship. It doesn't mean that all counselling has to be long term. So I've seen clients for as few as 6 sessions and they've seen the difference they've needed and moved on. And then I have longer term clients that I can work with over a few years. It's important to say that when I talk about seeing clients for a few years, that they often have things like dissociative identity disorder, or DID, which means that I'm working with multiple personalities, so it can take a long time. So there's not an average kind of time that people have counselling for, but it's not the counsellor's job to keep you stuck, and it's really important that there's breaks along the way where the work can be cemented and that you're not stuck in therapy for the rest of your life. I like to look at it as you do a chunk of work in therapy that helps and supports you, and the door's always open for you to return, but there's not an expectation for you to be in there for years. So I think that's quite important to say, because again, a lot of people think that a therapist will try and keep you stuck. Also, I think sometimes people come with the expectation that therapists and counsellors can diagnose you or offer prescriptions or will try and push you down that route. So every therapist is different, every counsellor is different. Even if we work within the same modality, we'll all be different with individualised experience. However, a counsellor isn't qualified to diagnose you with any condition or prescribe medication. It's really important that that's kind of said from the off. Often clients will begin their counselling journey and say, I feel really anxious, I want to go to my GP and speak to them. And a counsellor will always support a client to get medical advice on what might be right for them, but it will be the GP or the mental health team or the crisis team that would aid with that. And if a psychiatric review is needed to assess whether there's any diagnosis, that is done through the healthcare sector and not the counsellor. So it's not a counsellor's role to push you down any medical route at all, but if it's something you want, they will be able to support you with that. And I like to think of labels a bit like a roadmap. So sometimes clients need the label to feel validated and to understand their experience. And it's like a little signpost on the map for me, but I like to work with the client behind the label, as do most therapists. So hopefully that helps kind of understand that we're not medicalised. I think as well, it's interesting that a lot of people think counsellors are perfect. So I have a lot of comments about how good it must be that my life's so easy and sorted and that I'm perfect. And this is a bit of a spoiler alert, but counsellors and therapists are people too. So we have bereavements, we have redundancies, we have family stresses, financial pressures, just the same way that anybody does. And although counselling is a very different sort of relationship, it is a reciprocal therapeutic relationship. So whilst I might not sit down with my clients and say, oh God, my week's been like this because you're not here for me, there is a connection between us. So it's really easy to think that therapists are all put together and everything's perfect, but that is just not the case. That's just, how it is. I had a recent inquiry where I was asked if therapy is just for people that are alone and have no friends, or connections locally? And that, I thought that was a really interesting question. So one of the reasons that counselling works so well is because you can share information in an unfiltered way. And I'll be doing another video on how counselling works shortly. But really, if you think about when you talk to your family or your friends or your work colleagues, you always leave out certain details or subconsciously filter the information to make it acceptable, because you don't want to hurt somebody's feelings, or you don't want them to be judging you in a different way. So when you talk to whoever and you say it was about a relationship breakup and the person was unfaithful, you might not want to share that in the same way you can in a therapeutic space. So whilst it can be useful for people who have less of a wide support network, actually anybody can benefit from a therapeutic space that's non-judgmental and where you can share openly and at depth without feeling like you've got to filter out certain information. I think one of the biggest and often frequent comments that I get really is the fact that counselling isn't cheap. So often people will say, why is counselling so expensive? And I think you have to look at the scale of counselling. So, you know, I live in Warwickshire, in North Warwickshire, and the scale is between sort of £35 to around £70, depending on the therapy that you're looking for. And it changes all over the place. So as you'd expect, it's reflective. So in London, obviously that price increases massively. There are counselling services available through the NHS, through charities, and some charities will ask for a small fee, a donation, and others it will be free. But what people aren't aware of is to train to be a counsellor takes a great deal of time and costs a great deal of money. It's like any self-employed role. You have things like insurance, you have supervision, which is where you seek guidance through a more senior therapist who's been doing it a long time. You have to belong to awarding bodies, which incurs a membership fee. You have insurance, you have all the normal things that you'd have through being self-employed. Most counsellors will offer a sliding scale. So if you wanted to access therapy immediately and you're told that a charity you've approached has got a 2-year waiting list, you can approach counsellors and ask if they will do a sliding scale and perhaps have a look at what you can afford. But it also is about prioritising mental health. So I had a client recently who said they gave up their Costa a day and their fake tan and their sunbeds to afford therapy. Now, not everybody has those luxuries in life, and I understand that, but sometimes there's a way to wiggle around that, and it is about choice. So there are some fantastic charities and NHS providers that will give you counselling that's of good quality, but private counselling does cost a little bit more because of the overheads that are incurred. So they're kind of the main themes that I've had said to me regarding counselling and some of the myths that are there. I think it's hard to find some true reflections of what counselling looks like because of the confidential nature of it. It's not like it's open. There are a couple of programmes I would recommend. So there's something called In Therapy on Channel 5 with Mandy Salagari, who's an amazing therapist, and that really depicts more of what therapy's like. So it is talking based, but I will use creative methods, sometimes art, sometimes tactile things, sometimes psych ed to kind of give people more information. So if anybody's got any comments or wants to get in touch for further information, or is worried about something, or has heard something that therapy is about and is unsure, please feel free to get in touch. I will put the website link below in case anybody wants to have a look. But thank you for watching, and I hope to see you soon.